Joining us this morning is Dr. Jumbo Hezekiah. He is of the University of UUTH Teaching Hospital, of course, of the Department of Hematology. Thank you so much for joining us.
Thank you for having me.
All right. And then we also have the very beautiful, she's looking so gorgeous this morning, Treasurer Asuko Etiemana. She is Acting Chief Nurse Officer. Did I get that? Assistant Chief Nursing Officer of the University of UUTH Teaching Hospital. Now, she is a warrior and a survivor. Thank you so much for being on set with us this morning. Okay, we have serious issues here, serious concerns, the burden of sickle cell anemia, but I think we should rather start from the basics. Now, we are celebrating this day as an international day, which means that it calls for a lot of concern, and that's why, of course, we see that a particular date has been provided for us to bring forth awareness. But for me, I feel that, not just for me, for the media, it's not just about celebrating on the International Day. It's about the constant talking about these issues and bringing it to the fore for everybody to understand, you know. So let's start from the basics now. What is sickle cell anemia? I should start with Dr. Hezekiah. Go ahead, please. Okay.
Sickle cell anemia is a genetic disorder of involving the beta hemoglobin, and is characterized by
beta hemoglobin.
Yes.
So is there a sweet one?
Okay, not as in beta or sweet.
Okay.
It's as in alpha or beta.
Okay.
Yes, there's an alpha hemoglobin, there's a beta hemoglobin, and what that simply connotes is that it results in a chronic hemolytic state, in that the red blood cells don't live up to the usual lifespan of 120 days. So, and while theirs live up to between 2 weeks and 80 days. So it becomes a problem, and so it results in several complications, and them being in and out of the hospital because of this anemia, which is the reduction in the oxygen carrying capacity of the blood. So,
is there a way that now with sickle cell anemia, is it like when we say non-treatable diseases or disease that can be treated, what bracket does that fall in? You know, like when someone has malaria, if I take the right medication, I'll be done with that. But what's the lifespan of treating sickle cell anemia? Let me talk to you, Nurse Treasure.
Okay, actually, sickle cell disease is not a death sentence. It's a manageable condition. Giving an enabling environment, the person concerned, the patient, can live to any age. In fact, presently, you have somebody 98 years here in Nigeria.
Wow.
Yes. He's an academic professor.
That's the oldest living warrior.
Yes, here in Nigeria.
Okay.
So they can, giving enabling environment, they can survive. You factor in other things, taking your medication, keeping your appointment, eating well, resting well.
And taking medication is lifelong, so you're on medication for the rest of your life.
Like my doctor rightly says, because of the inability of the red cell to carry oxygen, enough oxygen, of course the cells don't even survive that long. It's just a matter of 20 days, they die off and the new ones come up. So that's why you have most of them coming down with anemia, and that's low blood, and then they have issues. So in managing them, it entails a whole lot of things. You consider their mental state, you consider the environment, how they rest well, and all that. In fact, most of them presently are living in depression, and you see them contemplating suicide because of how it is. So that's why we are here today, just to create awareness that, look, this disease might be invisible, but the burden is weighty.
Yeah, really weighty. Now, before we even go into talking about the burden now, let's come back to Dr. Hezekiah. Causative factors. Because I know that a lot of people will say, because of love, I decided to go into a relationship. But let's look at the major causative factors why we are even having this conversation in the first place.
Okay, the causative factors are one, lack of awareness, and also lack of proper testing kits. And also people perhaps, especially in this our climb, maybe jumping processes. When I say jumping processes, I mean like you want to take a job, you're asked to go do your medical examination.
Yeah.
Now, if you had gone to do that medical examination, you would have been tested. And amongst the routine tests, your hemoglobin genotype is usually part. So, but people sometimes jump the gun and not do the test, rather just meet someone to
Scribble down
something without checking themselves. And when it's also a criteria for admission into schools that these tests are done, even primary school, secondary school, even the university. And you find out that if you have done all these tests, you would have known that, oh, I am AS, I am AA, I am this, or I am SS, and I am that. So at that point, if you are SS or you have any S, you just should know that if I'm going to be in a relationship with anybody, then the person must just be AA. So if I am S, if I have any S, if I have any C or whatsoever in my hemoglobin that is not just all A, then I must marry somebody that is all A. Then the next thing is this deception, because I've heard people say, you know, sometimes you have cases of, will I say, lust or infatuation.
No, it's love.
No, okay.
Yeah, it's not love.
I agree with doctor at this point.
Okay.
I agree with doctor at this point.
You see, there is no amount of love for someone that would make you cause your progeny to suffer. In fact, when you see your child go through the stress of what you willingly, it's a different thing when you're ignorant.
Okay.
But when you willingly consent to having a child with sickle cell anemia, or maybe you just base it on, God won't allow. You can't be doing A and calling, and expecting God to do B. So you then find out that sometimes some people would know their genotype and they will tell their spouse, oh, I am AS. And the person I'm supposed to get married to is AA. What is your genotype? And because they are so, like you said, in love, let me not say lust or infatuation. Yeah. You know, the person would lie and say, oh, I am AA. And they go into marriage only to give birth to a sickle cell.
So compatibility now, very quickly, compatibility. If I am AS, must it be with an AA? Or so an AS and an AS cannot even be compatible? Is that what we are saying?
They are not.
That's like Mission Impossible.
It's like Mission Impossible.
But there's another one you just mentioned. I heard you talking about AC. And AC should also go for AA.
Yes.
That's a type of that blood.
Yes.
Break that down, because I know another thing with this is incomplete information.
Yes.
So we know about AA, we know about AS, but sometimes we do not know about this and SS. Sometimes we do not also know about this AC and all of those other ones in between. So what's the AC stand?
Okay, the AC, we have the SC and the likes. We have the X beta thalassemia.
Are these rare combination of genotypes?
Rare combinations, but the worst of all these combinations is the SS.
Okay.
You get that would really, you see people with SC. We've seen popular celebrities come out to tell you, oh, I am SC, like
Lekon, yes.
Like Lekon. And you see them, they do well, they don't come down easily.
Okay.
And even amongst the SS, we have what we call the sickle cell haplotypes. Now, these impinge on the severity of the disease, because the Benin and the Bengal, those ones are more severe, unlike the ones we call the Senegal and the rest.
So that means that there are, you know, types of sickle cell that, because when Nurse Treasure was telling me the other day that she is a survivor, I was like, no, like she's a warrior. I'm like, no, you don't look it. So there are people that you see, immediately you see them, you just know that yes, this person is, you know, under this health burden, and there are people you see, you don't believe even when they tell you. So it means that there are different types of sickle cell, and it also has to do with all the impact it's having in your health.
Yes. And do you know, let me not say to shock you, that we've diagnosed a patient at 70 of sickle cell, and that's the first time the person is knowing that he has sickle cell.
The question of how did the person survive till that time without knowing, because one of the myths that we have surrounding sickle cell anemia is I don't know, that sickle cell anemic people cannot survive beyond 25.
But once you go beyond 25, that means it's all over.
Once you're 25, you will never be sick again of sickle cell.
We heard that a lot.
You know, just once to struggle, try to just keep your child to 25. Once the person does into 26,
crosses that borderline.
But so just to answer that, Nurse Treasure, you know, handle the myth around that age thing. But then again, differentiate for us when someone is called a warrior and when someone is referred to as a survivor. What's that about?
Well, we call them warriors because they've been through so much pain, not just the mental pain, the physical pain, so much trauma. It's worse when the parents or the family is not even there for them, and I've seen families that break up, marriages that break up as a result of this. Like you said, when they get to 25, it's a total myth. Me, I'm over 4 decades and I don't look it. Yes, just like my doctor said, it still stems from the types and all that. But above all that, it got a lot to do with the environment, the mindset, the people around, and all that. The child can survive, conveniently survive to any age of their choice. Why we lose them young is because at that tender age, they don't understand their body system, they don't know where to cross the line, they don't know what exactly to do for themselves. I'm saying this as a warrior.
Okay.
In my growing up years, it was not that funny, as I didn't even have opportunity to stay with my parents. I started living very young, in fact in my primary 1, with somebody, and I spent some 27 years under somebody's care. But it wasn't funny, you know, when you're not with your own parents, you know what that means. But I had to go through all that. In my primary education, I did most of my exams on hospital bed. It was that bad. According to what my mom told me, it was when I was 3 months old, I was always falling sick. And then one of those days she went to the hospital and the nurse just told her, I said, Madam, we have to check the genotype of this child. So it was there and then, it was glaring. The result came out SS. And my mom was like, wow, what happened? From there, she had to do her own because she didn't even know. And my dad equally, they run East and they came down with AS. So these children can live to any age. That's why we are here. If parents could make it an intentional thing, because in the hospital I've seen some, they'll just walk in and the parents will tell you, I'm tired. If this child can just die, let the child just go. I'm tired.
And then sometimes the child will be hearing that, adding to the mental.
You know what is on their mind? This is my parents' fault. They feel that actually the mistake the parents made. Some feel there were some accidental discharge that just happened, or there's some bomb blast. That's what they are made to believe. But the stigma is so high, it's so alarming. They feel that some bomb blast going somewhere to happen, whereas it's not. These are unique individuals. They never created themselves. In as much as the parents must have made a mistake, they are not the mistake themselves. So we are here to tell our people that, look, the burden is high. The scourge is real. Please help us break the chain by checking your genotype.
It's very necessary. But let's look at the health burden now. When you say that someone has sickle cell, what does it entail what are the things that the person is facing or will be facing. You know, so it looks as if sickle cell is just one sickness like that, or one disease like that. But I know that sometimes they come down with crisis that has to do with body aches and, you know, different things. So just break it down for us to be able to understand, so that it's good, so we get to appreciate what these people are going through and why they choose to call themselves warriors as well. Okay.
If I would, let me dive a bit into like the pathophysiology, or how it happens in the body. Now the thing is this, now the oxygen is carried by the red blood cells, and these red blood cells are like what we call discoid in shape, like a disc, and it remains like that throughout circulation. Now, so when it takes oxygen from the lungs down to other parts of the body, let's say the toe, then you find out that as it's going down to the toe, it still maintains its shape. But this sickle cell red blood cell, when it's getting down to the toe and it's losing its oxygen and giving off oxygen to the tissues, the shape changes. It becomes crescent, just like the crescent moon. Now, some of them, when they now get into a high oxygen tension area, they can recover their shape. So, but this continuous change in shape cause the red cells to be damaged, and some, they now become irreversible. They are tired of changing shape, and they now remain like that. Now the flow becomes difficult. The function of carrying oxygen also now is also not there. So you then find out that they will be removed from the spleen, and all this process damages the cell. And once they become destroyed, iron is being let out into the body, and iron is a free radical, and that can damage tissues. Now all of this put together will cause all the what we call sterile inflammation, the bone pain crises. There are some with sequestration crises.
What's sequestration? Doctor, break it down.
Okay,
so that
that's the sequestration crisis is like, now this patient has the blood levels are maybe, let me say, within normal range, but they are all trapped in the spleen. So the blood is not in circulation. So you now see the spleen being enlarged, but the person is anemic, and that spleen is engorged with blood. So these are some of the complications. Then you then find out that because of all of these, the constant production of blood, you find out that every part of the bone is now being recruited to producing blood. So you then have what we call the frontal buzzing, the heads being somehow bigger, you get. Then we have what is called anatopathy, that's the upper jaw protruding. Then we can have like extended butte, the hands and the legs become longer with shorter abdomen. So they have this physique that is maybe characteristic, and people would say, this person has,
readily, you just know.
So for babies, they have hand and foot syndrome. The hand and foot syndrome is a process where blood is trapped in the hand and cannot return. The hands become swollen and painful. So these are some of the things that are picked up in childhood that would make
but are they also vulnerable to other diseases, like some of them would come down easily with malaria or other, you know, illnesses? Are they vulnerable to that?
And let's even talk about that in, like, not just having like malaria, like other terminal illnesses. Like for instance, someone is already sickle cell anemic, then you're having, for instance, let's say that same child was born with HIV. How do you manage all of that?
It's add to the burden. Then you now find out that normally, even in patients or children that don't have sickle cell, on the under 5, it's like a critical age way you need to take care of the children, such that we don't lose them. So you now find out that coupled with this sickle cell condition, their mortality rates now increases. So the mortality rate here is really high
because of poverty.
Yes, because of poverty. Then the healthcare system is not there. Now the sickle cell can, like the hemoglobin electrophoresis, are not there in the primary healthcare center that is closest to the villagers or the people in the rural community. So it now becomes difficult for even parents to test or to know. And you find out that everybody now comes to, like, let me talk about that, everybody comes to the teaching hospital or comes to the general hospital and just to know if a child has sickle cell. So whereas it's not supposed to be like that. This system
cannot quite carry, you know, the burden of the numbers. Let's talk about managing you know, sickle cell anemia in terms of like treatment. You know, there are some illnesses that say you can't eat this kind of food, eat this kind of food so that you can live longer. And then when we hear of the progressional treatment, bone marrow transplant, at that point, is it that once the person has had a bone marrow transplant, they are said to now be free of sickle cell anemia? Not Treasure.
Thank you. Talking about how to manage sickle cell, you factor in so many things, from their mental state, eating well, not just eating well, balanced and adequate diet. So it means the parents must be very concerned about them. That is from their standpoint of knowledge.
Does the condition select food type?
Not really. Okay. Not really. Like me, I do a lot of fruits. I'm not really the carbohydrate type. I do a lot of fruits. I eat more of soup and vegetables and all that. So it's just for you to know. That's why I tell my warriors, I say, just know what works well for you. They might have allergy to certain things, but understand how your body system works and know what works well for you. Know when to draw the line. For instance, now it's cold, the weather is cold, and then you want to go out there for TM, you want to go for events because your friends are there. I tell them, I say, look, you don't necessarily have to impress anybody. It's about you first. You love yourself. It is called first self-love. You love yourself. You know when to go out and when not to go out, when to present yourself. What happens if you attend the event and as you are alighting from the vehicle, the crisis comes because of sitting down for a longer time, assuming a particular position? To most people, they can't stand that. You know, you are not very good in heights, going heights, flying, taking flight and all that. Most people can't stand that. And of course, the higher you go, the altitude, the oxygen carrying capacity, it's low. So we avoid that. Though it's once in a while thing, but you have to prepare yourself. Know what works well for you. So talking about nutrition again is very, very important. A child that does not eat well, rest well, will definitely come down with, like we're talking about anemia, sickle cell anemia. They easily come down with fatigue, weakness and all that. So the child should be fed well, adequate diet. It will really go a long way to give the strength, to boost the strength and the immunity. Then the mental state too should not be overlooked. You see most of them being depressed. This feeling of guilt. Why am I even born? Why was I born?
Feeling worthless. Point they feel they want all the love that they can get
all the
from
love
family
they can
members,
gather,
from friends and
they
all
need
of that.
all the love, all the support. Some of them are being stigmatized even in workplaces. For instance, they can plan to go to work and that morning they wake up, pain comes. Now it's very cold. Extreme temperatures is not ideal for them. That is extreme heat and extreme cold. It's not ideal for them. So they can wake up in the morning preparing for work, the pain comes. And you call your boss, please, ma, I'm sorry I can't make it today. They're like, this is your sickness. Every time you're always giving excuse. No, that's a stigma. And each time a warrior gets to hear that, it demoralizes them. They feel, oh, I'm not wanted, I'm not being supported. Nobody understands how it feels. And of course, I'll tell you as a survivor that most times our people don't understand. They might feel we are pretending or we are being lazy. You understand? So that kind of thing should be avoided. That's why we are here. I'm here to advocate, not just for myself. I need others to understand what it feels like to be a sickle cell warrior. That sometimes it's not easy for us.
Okay, so I know that we just have about 3 minutes for us to wrap up this conversation. But very importantly now, I know there's been so many pushes and drive, you know, for governments to, you know, come on board in terms of policies to help those living under this burden of sickle cell anemia. I have friends that are warriors as well. They tell you that even the littlest thing like folic acid, that is more like, you know, a routine for them. They do not even have monies to buy it. So very quickly now, let's look at some of the policies that government can bring on board to help, you know, relieve warriors of this burden.
Okay, there are special clinics for them. Like we have the sickle cell clinic. If government can fund those clinics and provide them with these routine medications, just like it's done in Delta State. They have a policy, a government policy to protect them, and also to give them jobs, and also to make sure that the jobs are suitable with their conditions, and also to give strict rules, especially to schools, not to
admit without
once a child has a sickle cell, then you should see that child as a special student, and you should tailor your training in line with the patient or with the child's health condition. There are schools that once you miss exam, you've missed the exam, and they don't bend for anybody. It should not be like that.
These kinds of consideration
should be made so that the child does not maybe lose his or her life trying to get a degree because of the stress in the school. And then when you were talking earlier, you talked about the bone marrow transplant. Now, for bone marrow transplant, the transplant helps the body to start producing A, that's the A hemoglobin, and so the patient's phenotype, hemoglobin phenotype, becomes AS, whereas the patient is still SS genetically. So it still means that the person that has had bone marrow transplant should not marry somebody that is AS, otherwise the patient will produce an SS.
But at that point, is the person's health more stable?
It's better. Yes, but better. In fact, if not that we don't have time, you find out that it's an evolutionary trend to help people living in the malaria belt to survive malaria. That's why you find out that people with AS don't come down easily with malaria. So I think that's even
a different conversation on its own, because we've had situations where they say, oh, those that have AA are those that are prone to malaria. I am AA. I don't come down with malaria easily. I can fall sick maybe once in a year or twice in a year and all of that. So it's a conversation that we might just have to delve in much later. But because of time, this is just where we have to draw the curtains. But even talking about the bone marrow transplant, how many Nigerians are able to afford bone marrow transplant? So it still brings us back to the burden of you know, this particular health that is asking for government interventions as well.
I think a strong take home from this morning's session will be the fact that for instance, new governments have come on board. I will be stretching out to the likes of Governor Umoino of Akwa Ibom State and other state governments. I like the aspect of sickle cell special clinics where you know that if this child or this person has this condition, let's go there. So let's see how we can push these kinds of conversations from our primary healthcare boards to health ministries and the likes. I think it will really help if we can establish that as a matter of urgency.
And also as a matter of policy, that all newborns should be screened for sickle cell.
Wow.
So if we have that policy in the state, that any child that is born is screened for sickle cell, that way you'll find out that the child comes up knowing that I am AS.
I know everyone knows how to handle the child from the get-go.
Yes, from the get-go, the child knows I'm not to marry anybody that is AS. We reduce it from that level.
Okay. All right, a very big thank you to you both for coming on the show this morning. Dr. Jumbo Hezekiah, Department of Hematology, UUTH, University of Uyo Teaching Hospital, and Nurse Treasure ATM, who herself is a warrior and a survivor, Assistant Chief Nursing Officer, UUTH. Thank you so much for coming on the show and sharing your wealth of knowledge.
Thank you.
Thank you.